Hi, welcome to our webinar as part of the Caregiver Empowerment Program for people who are supporting individuals with intellectual disability. Today, we're going to look at keeping safe, and some of the topics that we'll be touching on include social media, keeping safe on the internet, relationships, and sexuality. My name is Dr. Charlotte Capri, and I work as a senior clinical psychologist for NUA Healthcare. If we take a look at today's webinar, it's about providing you with helpful information about careful and meaningful inclusion in society and positive risk taking for the person that you are supporting. We'll discuss sexuality, keeping safe while using social media and being on the World Wide Web, and different kinds of relationships. We'll discuss some of the thinking involved in support of the transitions that people with ID go through as young adults. And this webinar is suitable for caregivers and family members who wish to learn more about how to best support individuals with intellectual disabilities so that they feel included in the world while also reducing the risk of harm. So if we look at the content of what we'll be talking about today, we'll be talking about life transitions, the changing needs and the changing supports of people who live with intellectual disability. We'll talk about testing the waters, positive risk taking while staying safe. We'll be touching on the internet and the use of social media and doing so safely. We'll talk about safe and healthy relationships. We're going to talk about sexuality, and we'll then end up with a summary. Before we start our first topic, I do want to let you know that during the seminar, you'll see that there are helpful links that you can go to in your own time. And at the end of the webinar, there'll be a whole bunch of resources that you can look at and you can turn to when you have a moment for you to look at in your own time. We're going to start with life transitions and the changing needs and required supports of people who live with intellectual disability. Now, as we know, with any change, there will be trials and there will be trepidations. So in previous webinars, we looked at some of the difficulties that individuals with ID and their caregivers can face. So changing into early adulthood can be a really anxiety-provoking time. It's a transition from school into this next life phase, and it can be exciting, but it can also hold a lot of uncertainty. And young people with ID face unique challenges with this transition. They might need more support with new demands of daily living, learning, relating to others, and work. And transition experiences for young people who live with ID might be very different from those of young people who don't live with ID. But different in what way? So, for example, a person with intellectual disability, there will be aspects of the transition that may be very different for them. For example, leaving home. A person with ID might stay home for longer into adulthood. They might have left earlier to enter a service, for example. Managing money could be something that a person would need support with. Legal competence and capacity can be an issue, so the ability to make autonomous decisions regarding their life, the ability to participate in legal processes, for example, and having an independent social life and finding and maintaining employment are some of the things that people with ID transitioning into young adulthood might find different from people who don't live with intellectual disability. But what does transition even mean? So it's an important time of working together in new ways in order to meet goals that a person has set for themselves. This can involve people from various organizations and agencies. The purpose of the transition process is to reach specific goals for an even better life. And to reach these goals, new supports may have to be required and they must be identified. So for young people and their families, changing from children's to an adult service, can be very daunting. In an adult service, for example, supports are coming from various different organizations, and it's quite different from being in a child and adolescent service where there's almost like a team and a one-stop area where one can get information and support. But early planning will help make this adjustment from school to adulthood much easier and build confidence and independence for everybody involved in supporting this person's transition into young adulthood. So, we spoke about transition planning, and there's so much to think about. Where do I even begin? So, one of the things that we're going to talk about is a transition plan. And on this slide, you can see some of the typical things that we would include in a transition plan. And we'll be looking at each one of these in a little bit more detail as we continue. So, let's begin at the beginning. What is it transition planning? So, young people and their families, normally a good time to begin with transition planning would be around the ages of 13 to 14 years old, younger than one would think. We would nominate a coordinator or a point person out of the young person's support network, and it'll be a person of their choice. There might already be plans to draw from, so there might be a plan in school, in another service that they were involved in, perhaps from a social worker. And the point person or the coordinator would take all of these documents and compile them for the transition plan. And these plans are normally reviewed annually, so they will be very current and they will have information that can be useful. So the point person is nominated or named from anywhere within the young person's existing support networks. It has to be someone who has had meaningful engagement with the individual and is very familiar with them. It can be a key worker, it can be a GP, a health or a social care worker, an education practitioner, anybody from the person's support network. So what we do next is we start building a personal folder. And in this personal folder, we tell services and supporters what they need to know about the person. Again, it will be someone who is very familiar with the individual. The folder will link with existing plans that are in place. But the individual whose folder it is should be able to choose what information to include and how they want to have it presented. So what would be in this folder? It would have a summary of the individual or person at a glance, followed by detailed information about important aspects of their life. So what would be your level of involvement? Because this is changing, and like we said, it can be very exciting, it can be very anxiety provoking, and also quite daunting. And really, what it comes down to is the balance between letting go and letting the person explore and take positive risks and supporting them to do it safely, but at the same time also staying near. So to be there when things go wrong and when the person comes back and asks for advice and needs to talk things through and process things with you. In this whole transition planning, there is so much that I have to know. There's so much that I have to look at, so much information. Is there ever enough? Am I ever going to know everything that I need to know? The truth is, at some point, the question might rather be, do I have the information that's right for us? So it's not so much about, do I have enough? Do I have what I need? It would very much be around, do I have the information that is right for us and that is right for our purpose? We don't always know what to expect. It's new, it's unfamiliar. We don't know how this is going to turn out. To make use of supports that are there is something that we would highly, highly encourage. You can also think about visiting various services, meeting with people, meeting various practitioners in areas or services where your adult will be involved in, attending joint appointments, or clinics with the person that you are supporting in the beginning. Talking to adults and families who are in similar positions or who have been in similar positions, finding support groups online or in person, and inviting relevant people from adult services to the young person's next review meeting. So we're going to move on to topic two, and that is going to touch on the idea of positive risk taking while staying safe. So as we said, transitions can be risky. There's so many unknowns. There's new things in the transition process. There will be risks involved, but they can be managed. Transition marks a time where an individual grows toward independence and gains greater choice and autonomy, but it can also be a very risky time because they need experience to learn about their limits and the supports that they're going to require. And that's the thing, because young people with ID may not have had adequate opportunities to develop the skills that are required to manage risk and to minimize risk. So most young people may lack those life experiences that relate to risk-taking behavior, for example, their first sexual encounters. And we do have to bear in mind that unfortunately it is a reality that all over the world, people with ID remain at increased risk of exploitation and abuse. And that's the last thing that we would want for the person that we are supporting. So again, for families and support networks who are guiding a person with ID into young adulthood, this can be a source of a lot of anxiety. There's often a large difference as well between the risks perceived by the young person with ID and those perceived by their carers or their parents. And we have to keep in mind that an individual's perception of risk will vary according to their abilities and their understanding and their life experiences. It's really hard, and we want to keep the person safe and we want to reduce risk. But we also don't want to restrict their autonomy or their access to appropriate and available opportunities. So it might help to think about two parallel transition processes taking place. So, on the one hand, the young person with intellectual disability is transitioning from school and childhood into this phase of young adulthood. And at the same time, the parents, the families, and the carers are actually also in transition. They're going through their parallel process. They're going through their own transition process. And again, it's about letting go but staying near. And we know that it can be very, very tricky. The process from moving on, from being very involved with your child's journey to becoming less involved, really is a transition process in and of itself. So again, it might be useful to think of your and the person you're supporting, to think of your transition processes as taking place in parallel, like train tracks. They're running together, they're running alongside one another, but separately toward the same destination. So parents also face life challenges as their child transitions to young adult life. Um, you know, Parents are usually very involved in the child and adolescent services, but this becomes less so in adult mental health services. It's very challenging for parents to adjust their roles in order to promote the child's growing independence and life choices. It can be really, really hard to find that good balance between one's duty to protect a young person with ID on the one hand and their rights as young adults on the other hand. And this balance is really complicated for young people with ID because of vulnerability. Support will play a big role in protecting them from risks. We've spoken about exploitation, manipulation, and risks relating to internet use and being in relationships and having sex. So, we want to enable safe risk taking so that they can learn new things and gain new experiences. Every time any one of us tries something new that we've never done before to improve our learning or to improve our quality of life, we're practicing positive risk taking. There are benefits to positive risk taking. We learn new skills, We get a sense of mastery. We improve from our mistakes. We're exposed to new experiences, and we get a chance to experience and get a sense of what feeling successful feels like. And we gain confidence. But let's think about some examples of positive risk taking. For somebody with intellectual disability, they might be taking public transport for the first time independently, going to a shop on their own, making purchases, using social media, using the internet, trying to make social interactions and exploring relationships, building experiences at their own pace. All of these things can be brand new. So, moving on to our next topic, we're going to look at risks involved in using the internet and being on social media and doing so safely. So, we have to think about young people with intellectual disability taking positive risks, but also know that there will be benefits to this, but there will also be pitfalls. The internet can be a great support for young people with intellectual disability, looking for jobs, looking for opportunities, for training sites, being included in world affairs, knowing what's going on around them, expressing themselves creatively, perhaps in a blog, for example, communicating with other people and socializing in groups, and perhaps feeling less isolated, and feeling less lonely. If we think back to our slides on positive risk taking, the internet and social media can actually be a really good example of balancing benefits with potential negative impacts on a young person with intellectual disability. So keeping cyber safe, as we've said, the internet can have a lot of benefits, but there can also be a lot of pitfalls. And we're going to just take you through an example of how to weigh up benefits, and how to think of the pitfalls in any way that we would be, supporting a young adult with intellectual disability. So, for example, keeping cyber safe. What are some of the benefits? What are some of the dangers? So, benefits would be, staying connected with friends and family from anywhere in the world, and we all have relatives and friends who are living elsewhere. Interacting with people who share similar interests, for example. Like we said, encouraging creativity and getting involved with communities and causes. Now, on the other side, there might be dangers of social media, There might be questionable activities. There might be cyberbullying. And these things can cause harm. Individuals may post more than they should on their profiles. They might post photographs and personal information. Friend requests might be accepted, or messages from people that they don't know. And they might also be exposed to inappropriate advertisements. So, how do we teach and support self-protection skills on social media to encourage positive risk-taking and reduce the risk of harm? And there are some things that we can look at. For example, to apply kindness, to treat each other with respect and to be treated with respect, to always report online bullying to administrators or to parents and caregivers, to think before posting something, because everything stays online forever, even if we think that we've deleted something. We have to think carefully before posting anything. We wouldn't want our teachers or future bosses or future partners or our favorite grandma to see things. If we don't want them to see it, then we don't share it. You can teach the person that you're supporting about privacy settings, and you can also cast an eye over that. and to say no to piracy and phishing, So we can ensure that the person knows the importance of privacy settings and go through this with them, have really strong and unique passwords. Two-factor authentication, for example, can protect against identity theft. We can teach them about virtual private networks, to use those when it's possible and appropriate. To keep their protection software updated and their virus protection, to never share their credentials online with anybody, warn them and teach them about phishing, and to warn them and teach them to not sign up for any service contracts online. We also want to support them with learning about stranger danger. So if they get a message or a friend request from a stranger, we want to teach the person to ignore that and to delete it. If they're unsure about who the person is, they should always ask someone from their support network. What about social media and myths and social media influencers? And those are things that we can also advise and teach on and support this young person with ID who is transitioning into young adulthood. We would want them to keep an eye on the extent to which their views are being shaped by other people who are not necessarily within their support network, who are not necessarily trusted individuals that are familiar with our person. We want to debunk unrealistic standards. So, that chasing luxury goods, for example, or what is considered to be beautiful. We don't want them to be making fake news or to be participating in spreading fake news. And we also want to inform them and teach them about criminal activity. Sharing intimate images of or videos of other people without their consent is one example. Another one could be sharing intimate images or videos of themselves, over which they will have no control once it is sent. So really, self-protection on social media, it is a most important thing. We might want to negotiate with the individual who we are supporting, who is moving into young adulthood and who lives with intellectual disability. And we can do that by negotiating and agreeing on and setting really firm rules and boundaries amongst ourselves and the person that we're supporting. For example, you can have a social media contract with the individual that you're supporting, and it can cover things like mutual trust and respect of boundaries, among yourselves, what privacy protection will entail, and to contract that they won't be sharing their personal information, rejecting contact from strangers, not using social media accounts to hurt anyone else through cyberbullying, and to negotiate, to possibly negotiate things like parental controls, especially if contractual agreements start slipping. So what we have here on this slide is just some examples of sites that you can go to get some more information on cyber safety tips. Which leads us into our next topic. We're going to talk about safe and healthy relationships. Relationships are a big part of transitioning into adulthood, and we want to support the individual with self-protection in relationships. Falling in love, that can be an exciting and special time for any young person. Things can move so fast, and it can be so easy for anybody to get swept off their feet and to get caught up in everything. And at the same time, relationships can also be very confusing. So it's really important to support a young person with ID to recognize and identify and negotiate the differences between a healthy relationship and an unhealthy relationship. But we have to acknowledge, not everybody has the same idea about what they want from a relationship. But healthy and meaningful relationships have some things in common. And we'll look at these in a minute. By supporting an individual to learn about the ingredients of healthy relationships can really help them to spot the warning signs when these things are missing from a developing relationship or even from an existing relationship. Okay, so what are the ingredients of a healthy relationship? Okay, so like I said, we will be looking at them in more detail, but there are a basic bunch of ingredients. That there are things that important things that healthy relationships have in common. Now, one of the things that we can teach people with intellectual disability who we are supporting, um, is to be themselves in a healthy relationship. We teach them that they don't want to have to think about being themselves. They can just simply be themselves as a matter of fact. They shouldn't have to act in a certain way to impress someone or to get their approval. Their partner isn't putting pressure on them to change or to act differently. They have a life outside of their relationship, but they can do things for themselves, and they can do things on their own. And if their partner feels that they have to change who they are, we can advise them to consider, is the change going to contribute to making them a better person? If it's not, then making that change might be unnecessary. And in a healthy relationship, we can support individuals, with the idea that they don't have to give up their friends or family for their partner. Mutual respect, communication, and happiness. Those are more important ingredients of a healthy relationship. So we will teach the individual that, both people in a relationship respect and value each other's thoughts and opinions and boundaries. And they don't constantly feel like they have to defend themselves. If that is the case, that will be a warning sign. And that's something that we can teach them. Communication, for example. In a healthy relationship, both people feel able to communicate freely and they can express themselves openly and honestly. They feel listened to and they feel understood. And they don't feel that they have to keep on second guessing, what it is that they want to say. Happiness, another ingredient of healthy relationships. All relationships have disagreements, all relationships have ups and downs, but for the most part, in a healthy relationship, spending time together, partners spending time with one another is enjoyable, and people look forward to it. And their partner's company, they make one another happy. They don't dread having to spend time with one another. Compromise, support, and trust. More ingredients of a healthy relationship. So we can teach the young person with ID who we are supporting about compromise. And what that entails is, when two people make a compromise, they agree to meet somewhere in the middle. Both people are willing to listen to each other's side of things and to be flexible, and partners ask one another, what they would prefer. For example, one partner wants to go out and get ice cream, another partner would rather go to a movie, and in the end, they decide to have a walk in the park. So they meet in the middle. Um, Support in a healthy relationships. Partners can confide in one another. They support one another's decisions. They can tell one another what their worries are, and they don't have to feel that their worries aren't worth. They're not. It's not worth telling my partner what I'm worried about. And we can teach the person that we're supporting who lives with ID, and who is going into young adulthood and is curious about relationships. We can teach them about trust in a healthy relationship, and that really, it's probably the most important building block in a healthy relationship. We teach our person that they shouldn't fear that they will break, that their partner will break their promises or share their secrets or not stick to agreements. They don't have to worry or fret about what their partner is up to, or that they're actually speaking out. They're speaking out of the relationship. They're telling one another secrets. Insight is another important ingredient in healthy relationship, and what we can teach the person that we're supporting with ID there is that it's really hard for people to change their behavior if they don't understand where it's coming from. So we can support the individual with learning about making links to to our behavior and where it's coming from and why they respond in different ways. Which can bring one to insights, and being able to do that as a partner in a relationship really contributes to the health of the relationship and the well-being of the other person. So we can teach the person that we're supporting that insight means that they're checking on and they're being aware of their own thoughts and emotions, where these are coming from. They're also aware of their partner's thoughts and feelings. They can use this awareness with insight, and they can sort of think about their behaviors and their feelings, and they can really analyze these and try and anticipate how do they think they're going to respond in certain situations. If it's not going to be a response to the well-being of a healthy relationship, is there something that they can change? Is there something that they can do differently? So in a healthy relationships, partners also have insight into the other person. They think about how they are affected by that person's actions, but they're also thinking about how their behaviors affect the other person. For example, a partner might have insight into their partner when they understand that lateness isn't about the other person's laziness or because they're being disrespectful. A partner's lateness can actually be because they're really not that good with telling time, or they're really not that good with knowing how long half an hour feels, or if waiting for 40 minutes is too long. And also mutuality and equality, more important ingredients of a healthy relationship. So here, what we teach the individual that we're supporting is that both people in a relationship are equally important, but it's very easy for them to get stuck in their own perspective. So healthy relationships have mutuality and they have equality, and both people nurture the relationship and they nurture one another. So a question that we can teach the individual that we're supporting, a question that partners ask in a healthy relationship is this healthy for our relationship? Whatever decision is being made, is this in the best interest of our relationship? Another question might be, are we making a mutual decision? Are we in this together? And here we might have to draw on, what we learned about compromise, for example, or what we taught them about insight. And we tell the individual that we're supporting that one partner doesn't feel as if they're doing all the work. If our individual who we are supporting, if they feel like they're the ones who are carrying all the weight in the relationship and they're doing all the work in this relationship and trying to keep it healthy, it's not really a case of mutuality and equality, which is a warning sign. We want them to be able to recognize that. So in a healthy relationship, we want them to know that the other person in the relationship also carries their weight to keep the relationship healthy. It's not just the responsibility of the person that we're supporting. And emotion regulation is another important thing, right? So we teach the person that we are supporting that in a healthy relationship, both partners know what the other one needs and they care about one another's needs, right? So the idea of mutuality and equality also comes in. My stuff isn't more important than your stuff, or your decisions, don't override my decisions. And this ties into another vital ingredient, and that has to do with emotion regulation. So what we teach the individual and about emotion regulation is that if both partners in a healthy relationship have emotion regulation, it means that they can control their emotions in response to what the other person says and what the other person does. So in a healthy relationship, both people keep their emotions calm. They keep them in check and contained, They keep things that happen in the relationship in perspective. And they keep working on the relationship together. So we're going to move on to a next topic of ours, which is talking about sexuality and thinking about sexuality, you know, as a major thing for young people with intellectual disability who are moving into adulthood, who are perhaps, making new connections, keen to have a boyfriend or a girlfriend, keen to start a relationship, thinking about family maybe and marriage and houses one day. So deciding if and when to have sex with one's partner is an important decision for any young person to make. Actually, for any person in general. And it's all tied up in healthy relationships that we've just looked at, and how to incorporate sexuality into healthy relationships. So, deciding when to have sex with one's partner is a conversation that we might have with the person that we are supporting. And we want to teach them, in terms of sexuality in a healthy relationship, that they should never feel pressured into making a decision to have sex. If they aren't ready, that is completely normal. And as we learned in our earlier slides, in a healthy relationship, the other partner would respect that. I'm not ready yet, or I'm not ready to make a decision yet. And if and when they do want to consent to having sex or not having sex is absolutely the individual's choice. And sex in a healthy relationship should be enjoyable for both partners. The person should be able to talk openly with their partner and not feel pressure to do anything that they are not comfortable with. But it's such a personal thing, sexuality and deciding to have sex with a partner. Where does your support begin then? Um, and it really begins with helping a person to think about sexuality. So we're supporting a person with ID to live a full life. And that includes supporting them to be sexual, to have intimate relationships, and to express their sexuality and their sexual identities. It's a right and it's a privilege of adulthood, but it also comes with obligations. That is to keep themselves safe and to also keep other people safe. So, one way of supporting an individual with ID who is negotiating young adulthood is to continue to challenge the dominant myths and misconceptions that keep on restricting or overlooking and judging the sexual lives of people with ID. Adults with ID have rights and obligations. And as we said, sexual rights are among these. So to be seen as an adult who has privileges, but also obligations, the right to have relationships, the right to be safe from abuse, the right to not be abused, to not be exploited, the right to learn about sexuality. And learning about sexuality is about gaining knowledge about safe sex, about keeping your body healthy and keeping your emotion and your psychology healthy as well. And to be able to live a self-determined sexual life that's not directed by views or attitudes and decisions of other people. So, in support of adults with ID, we need to note what their thoughts are on sex in order to best support and progress their sexual lives and their sexuality rights. Then they too can enjoy the full expression of their personhood, as equal sexual citizens. So it's really, really important for us in our role, in our supporting role, um, in relation to the individual whom we are supporting, this young adult who is transitioning into adulthood. Um, Listening and learning from them. Ask questions, listen to what they have to say. Simply listening to them when they're ready to explore sex in their relationship is already an important way of supporting their rights. For example, learning about their values and beliefs and how these influence their personal and their sexual relationships. And facilitating peer support and self-advocacy can be really, really important factors in helping them overcome a stigmatized status as sexual adults. We often it's hear about how sexuality is a taboo. It's not something that's actually spoken about, and less so with people with intellectual disability. We have to challenge that myth. Sexual education is what will keep an individual with intellectual disability healthy and safe. So listening and learning from the person. People with ID, that they might be very clear about the importance of intimate relationships in their lives. Life without loving relationships can be lonely for any person. Having someone to love and being loved in return can be highly valued. People with ID might not always have been given opportunities to speak about their inner world. And it's very, very important that we take notice and that we listen when they do and when they are ready to. And to listen to what a person has to say about their lives and their desires, it really goes a long way in our role as supportive family members or parents or carers. And we might actually have to be prepared to have our own views challenged a bit. We have to bring in the topic of sociosexual knowledge and awareness, because we have to listen, we have to learn, we have to understand what level of knowledge, what level of awareness does a person with ID have, the person who we are supporting. What do they know about sexuality? And the reason this is important to have sociosexual knowledge is because having that knowledge will inform sex positive approaches, in the education and in the support that we will be giving. Finding out what a person's level of knowledge is, what their level of awareness is about sex and healthy sex and safe sex, is that it facilitates safety in sexual encounters because it matches the individual's level of knowledge and awareness to gaps in what they might not know yet and what they do need to learn. So we know how to personalize the sexual and sexual health pieces of education that we might have to give them. It contextualizes the nature of sexual interactions when reported or disclosed and responded to appropriately. It helps plan and deliver appropriate counseling and therapy when necessary, and it also promotes advocacy. So by informing outcomes of education and counseling and therapy for a broader group of professionals outside of the disability support network. So we know that people with intellectual disability might have had limited opportunities to express their sexual curiosity. There might have been a lot of family control, over opportunities to get this kind of education and to get this kind of support. We need to understand that getting in the way of an individual with ID learning about safe sex, learning about what they know and don't know about sex, what their awareness is. If we don't let them do that, we are actually creating a barrier to all people with intellectual disability, because receiving sex education would help them to stay safe. And that's something really important for us to think about. So as we said, in the beginning of the webinar, while we go along, you'll be shown, slides with helpful links that you can go to in your own time. So we have some here on links to safety and sexuality. These really are for you to go through. Some information might be more relevant than others at different times, but you hold on to these and just know that they are there for when you need them. Which will bring us to our last topic. And really, it's about summarizing everything that we've been talking about. So if we look back to what we've been busy with over the past 40 or so minutes, we went through some helpful information on keeping as safe as we can. We looked at some things to think about when supporting a person with ID, a young adult as they transition through their life stages and as they mature and as they experience new things and as they're exposed to things that they haven't had experiences of before, and to really help them do so safely. We looked at helpful information on positive risk taking, and careful and meaningful inclusion in society. Becoming included citizens. A person with intellectual disability, with the rights and the responsibilities that go along with that. And this led us to talking about sexuality, keeping safe while using social media and while being on the World Wide Web and surfing the internet, and different kinds of relationships. So we spoke about healthy relationships is what we would wish for the person who we are supporting. And we also went through some really helpful tips on what we can teach them about what healthy relationships not only look like, but what they feel like, and what some of the danger signs can be, what some of the red flags can be, and to educate them on how to identify those might also support them with coming to us with asking advice on how to get out of a relationship that isn't healthy. So adults with ID, they may be dependent on us for support, and those supports will change as they go through their life phases, as they gain new skills, and as they're exposed to experiences that they haven't had before. So we'll constantly need to adjust the supports that we give. But more likely than not, the adult with ID who we are supporting will need throughout their lifetime one or other kind of support. But we do have to keep in mind that we need to balance the positive risk taking with their autonomy, with the rights that they have, and also the obligations that they need to learn and that we need to teach them and show them and model to them. We looked at developmentally appropriate wishes and how to handle ones that get a little bit tricky, like having sex for the first time, and talking about sex, for example, like breaching the subject, this taboo, but how important it is to have those conversations. And the more knowledge that we can give somebody, the more awareness that we can give somebody, the higher the likelihood is that they will be able to keep themselves safe in a sexual relationship. We spoke about trying new things, using social media. Um, we really came a long way in this webinar in terms of your knowledge on how to best support an individual with intellectual disability, a young adult as they transition from adolescence, into this tricky phase of early adulthood, and how anxiety provoking it can be, but also exciting, but also confusing. And for you guys as well, for the carers and the support networks and the parents and the families. You're also going through your own transition process. There's changes that you have to go through. There's adjustments that you have to make. And there's assumptions that you might have held that are going to be challenged along the way. So compared to before we started, about 45 minutes ago, before we started this module, compared to where you are now, you should now have a much better understanding of the ways in which a person with IDs needs and interests can change, but that these are happening in developmentally appropriate ways. It's we want those things to happen. We expect them to happen. It's a good thing. We want, though, these things to happen in a safe way. And that's where our role comes in. You also know much more now about the ever-changing supports for living a full life. You know more about how to help a person with ID to use the internet safely, to navigate social media accounts and a social media presence safely, to surf the web. And you know about supporting a person with ID to have emotionally and physically safe and healthy relationships. You also have much more awareness now and knowledge of where to look for and where to find information on the topics that we've discussed in this module. There is so much that you can learn, that you can know and that you can do yourself in supporting and living and working with a young adult who has intellectual disability. So you're at a point now where you have more understanding, and there are some skills that you can apply. You are able to share knowledge about supports and strategies and techniques, and you also know how to use these in your daily life and in your role as somebody who is supporting a young adult, negotiating this life transition, and who lives with intellectual disability. And finally, just to thank you so much for your attention and for participating in today's webinar. And if you have any questions at all, please feel free to contact us. And there's an email address right here for you. It's the clinic department at nuahealthcare.ie. And once again, thank you so much for joining us. Take care.